Today I'm going to be talking about cystitis, also known as phantom pregnancy. What is cystitis? Cystitis is a phantom pregnancy occurring. It appears as a normal pregnancy, but the phantom part is there's no baby. Ramachandran had called it a fossil disease due to how rare it is. Um, to talk about how rare it is, there has been 600 cases reported in the past 200 years. It was first described as by Hippocrates in 300 BC. Two famous cases of cystitis is Mary Tudor, Queen of England. She had suffered cystitis twice, with one case lasting 13 months. Another case being Mary O, which was Freud's most famous patient. So what causes it? Well, 20th century textbooks authors suggested it was a psychiatric condition giving rise to complex feedback loops formed by classical operant conditioning. Modern physicians assume it's a result of pituitary or ovarian tumors causing hormones to release, mimicking signs of pregnancy. There has also been changes associated with severe depression that is correlated with changes in menstruation and ovulation that I will discuss the next slide, as well as cultural factors and associations of the mind. So the physiological changes, like I had mentioned before, with depression, it's been shown that there is a reduction of dopamine and norepinephrine, which are the joy neurotransmitters. They reduce the FSH, which is the follicle stimulation for ovulation, which increases the prophylactic estrogen and progesterone, all causing the impression pregnancy. As you can see in the table, the higher brain centers of the cortex and the limbic system impact of norepinephrine, which in turn causes the release of follicle stimulation hormones releasing factor or the prophylactic inhibitory factor, all leading to the FSH or the prophylactic decreasing and how it makes ovulation to cease. The physiological changes associated with cystitis is the cessation of menstruation, amenorrhea, and that is usually the first sign that there might be pregnancy. The other signs being abdominal swelling with that are usually caused by 5 factors of being an accumulation of abdominal gas, the lowering of the diaphragm, the pelvic part of the spine pushing forward, the dramatic growth of the greater apron of fat in front of the intestines, and then in some rare cases, there's actually uterine enlargement. Along with these changes, there's breast enlargement with nipple pigmentation, pica, and morning sickness. Many times, the distinguishing factor between phantom pregnancy and actual pregnancy is the umbilicus. It schools outwards, otherwise known as the innie belly button becomes an outie belly button. I found it really difficult to find any research regarding cystitis. I found many cases of it in rats, dogs, or cats, but not many in humans. I did find a case study of Southeast Nigeria in the Igbo culture, where there's a prevalence rate of cystitis in 1 in 344 pregnancies. Largely, the population is rural or mostly farmers, with there's high rates of poverty and illiteracy. Marriage is also valued and sacred. Pregnancy and childbirth not only confirm womanhood, but secure the woman's place in the family. With this, the woman's infertility burden is only placed on the woman, not the man. And after a given time, if the woman does not produce a baby, the man is allowed to take back his bride to her family and marry someone else. With this case in particular, 25 women had presented to the hospital for cystitis, with half the respondents of 11 people that have been diagnosed with cystitis, half of them had suffered either a miscarriage or child loss, which indicates that cystitis might be a defense mechanism for grief or a current state of seeming infertility, which goes back into the factor of cultural factors being a cause for cystitis. With Mary Tudor in particular, the stress of being needing to produce an heir for the throne, or just overall stress and how our society is focused on children and fertility. In the case of Southeast Nigeria, the treatment was clinical counseling, referral to a clinical psychologist, research on infertility and seeing what like their progesterone challenges to see what is that cause, if it's like a physiological change such as a tumor or if it's more psychological. Due to the complex causes and that there really isn't a true cause, we've within the medical community in the seeing it might be related to cultural influences or the hormone dysfunction related to pituitary or ovarian tumors. But there, in all cases, the psychological basis has been well laid out, and how in many cases there is a need for supportive cognitive, behavioral, and talk psychotherapy towards feelings of pregnancy and overall well-being. Thank you.